Dai. I am a graduate student of Professor Yang. My presentation is Advancement in Uveitis Imaging, a comprehensive overview. Uveitis is an inflammation involving the uvea, retinal blood vessels. Its diagnosis relies not only on clinical manifestations, but also on ocular imaging. In recent years, advances in multimodal imaging has significantly contributed to the management of uveitis. Multimodal imaging includes lots of ocular imaging, such as fundus photography, fluorescence angiography, endocorneal green angiography, and optical coherent tomography. Multimodal imaging could detect the ocular changes and the complications of uveitis, such as macular edema and retinitis. Multimodal could be used to assist in diagnosis and differentiate diagnosis. It can also be used to monitor therapeutic efforts. The most significant developments of imaging include the use of OCT. TD-OCT is an earning OCT imaging technology with low resolution and slow acquisition speed. FD-OCT technology replaced TD-OCT in the 2000s, realizing micro-level resolution and real-time high-definition imaging. FD-OCT includes SD-OCT and SS-OCT. It drives OCTA for non-invasive visualization of fundus hemodynamics. There are some differences between SD-OCT and SS-OCT. SS-OCT has a longer wavelength and a greater penetration than SD-OCT. SD-OCT is less expensive and more generalizable than SS-OCT. SD-OCT is more commonly used for retinal imaging. However, SS-OCT provides a clear visualization of deeper structures, such as the choroid. SS-OCTA provides non-invasive imaging of retinal and choroidal vessels. It is a technology developed based on SS-OCT. It offers centralized image analysis, such as vessel density qualification of layers of fundus and fovea, a vascular zone area. It has a great penetration to clearly visualize the retinal and choroidal vessels. Actual wide field imaging captures more than 80% of the retinal area. It can provide an imaging range of 200 degrees or more. It can detect peripheral vasculitis or slow ball-like clotting in uveitis. Panoramic view provides dynamic monitoring of disease progressing. FA can directly visualize vascular leakage. It can display diabetic vascular leakage. It is sensitive to recognizing uveitic retinopathy in the early stage. FA focuses on the retinal vascular wall. ICGA focuses on the choroid. The two are complementary rather than substitutive. Recently, our studies have focused on OCT and OCTA. Next, I will briefly introduce our finding in uveitis by using OCT or OCTA. EDI-OCT can detect retinal vascular changes in VKH. We found that VKH patients with poor visual prognosis had vascular proliferative lesions in the retina detected by EDI-OCT at 12 months following treatment. The vascular proliferative lesions were formed at 3 months following treatment. SS-OCTA is a useful technique in detecting non-vascular lesions in patients with VKH. We found that patients with high accuracy BKH disease exhibit neovascular lesions around the equatorial retina by wide field SSOCTA. SSOCTA could assess the effects of early and late treatment on choroidal retinal microvascular in BKH. We found that BKH patients who are treated within 2 months of disease onset showed a better choroidal retinal microvascular outcome as compared to those treated late. Sensitive SSOCTA parameters could detect retinal vascular alterations in basis uveitis. We found that floor area and visual density of deep capillary plexus were apt to be affected in basis patients. The paraphobia and peripheral flora of deep capillary plexus parameters were more sensitive to sensing subtle microvascular alterations as compared to other SSOCTA parameters. SSOCTA can detect ischemic retinal lesions in patients with basis uveitis. We found that patients with quiescent basis uveitis who had good central vision exhibit ischemic lesions in the peripheral retina by SSOCTA. With the development and advancement of technology, the integration of artificial intelligence and imaging is becoming more and more close. AI algorithm can automatically detect and qualify inflammatory lesions in uveitis. AI can be treated to recognize specific patterns and features of different types of uveitis. Machine learning models can predict treatment responses based on imaging features. This is our recent study by combining OCTA and artificial intelligence. We utilized an OCTA radiomics approach to establish AI models for the biomarker development and the automatic prediction of basis uveitis. We found that the radiomics score and the clinical integrated score can independently serve as diagnostic biomarkers for basis uveitis. In conclusion, advanced in multimodal imaging has provided more accurate tools for the diagnosis of uveitis and improved the precision of treatment. The combination of imaging and artificial intelligence has demonstrated a great potential for application in uveitis diagnosis and treatment. That's all my presentation. Thank you for your